Today for the lead agency office hours. My name is Erin Haldine and I'm the CFFS policy lead here in the Disability Services Division. Today we plan to go through a few CFFS updates and then answer all of the questions that were submitted to us, and then just do a review of the training and resources that are available to you. So like we said before, if you don't see your question, know that it might be combined with another question, or we changed the wording to best fit the group. We might have already answered it on our FAQ page, or well, sometimes we're still researching it, but I think with all the questions that were submitted this week, we do have an answer to all of those. If you happen to miss a previous meeting, you can go ahead and locate those at our DSD training archives page. We have all of them posted. I believe it's up to date. I haven't looked at it in the last couple of weeks, but if something's missing, we'll get it posted soon, but usually those are updated pretty quickly. So you can see copies of these videos as well as the PowerPoint presentation. Some new information for you guys. So this is, I think, our last office hours that we have scheduled or pre-scheduled with you already. We are going to change the frequency to once a month starting in May. So I don't have those exact dates published yet, but know that starting in May, we're going to try to meet monthly rather than every other week. And if for some reason that's not working, we can always go ahead and increase that frequency, but we're going to try to change it to monthly. Going forward, you don't need to pre-submit any questions to us. What we're going to do instead is just bring a PowerPoint presentation to you to talk about new topics or different announcements that we might have to make or changes to policies. If we're getting a lot of similar questions that are emailed to us, we'll understand that that's a topic that's confusing or that we just need to review a little bit more. And so we'll make sure to bring those to the meeting as well. And then I think we'll probably have some time at the meetings for you to put questions in the chat, and we can answer those individually each time we meet. So that'll just change the format just a little bit going forward. And we're also trying to figure out kind of long-term how we can do office hours for you. We know CFFS is a new service. We want to make sure that we're providing you with what you need and giving you enough support. But we know that a lot of you may not feel like you have the time to attend meetings, or you might not be able to pull everyone from your lead agency into the meetings to hear the material that's being presented. And so one of the ideas that we had is to kind of change the format a little bit to have it be like a train the trainer type of format, where we are training one or two people from your organization, or I'm sorry, from your lead agency. And then that person within your lead agency would take the information that we've presented and bring it back to the others within your lead agency to provide training to all those individuals who need to know the information. So we wanted to get your feedback on if you felt like that piece, the train the trainer, would be a good format going forward, rather than having, you know, several people from your organization or from its lead agency attend. So I believe we have a poll question that maybe can be shared. Is I think TTC was going to be on the call and put that up.
It's up now.
It is? Is it in the chat? Sorry. Kyle, was that you? Is it?
Yeah, there will be a button called Slido that if it doesn't pop up automatically, they should click on that and then take the survey.
Thank you.
Right-hand side, just like the chat is, or the QA or the participant panel.
Thank you. Thank you. I probably can't see it sharing my screen. Okay, so you should be able to see. Oh, perfect. I see it now. Okay, so you should see something on your screen that says, do you want the format for future office hours to be train the trainer? Select yes or no, and we'll just tally the results and pick what you guys think is the best format. Okay, thank you. And then this is a slide we've shared at almost every presentation, so I won't go through it fully, but if you're interested in learning what the CFFS authorization process is from beginning to end, from the time someone has an assessment to the time that the lead agency enters that service authorization into MMIS, you can go ahead and review that information online. And these are interactive links that you can click on, or icons that you can click on to learn more information about each step. We have a lot of different resources that are available to you that we just want to make sure to remind you of each time we meet. So we have our policy manual, transition from PCA to CSG and CSG to CFFS page. We have our service agreement calculators. We have our FAQ page, and then we have the MMIS reference guide. So please go ahead and look at those documents, familiarize yourself with them. They'll answer a lot of the questions that you likely have regarding CFFS. And then if you are not, if you have not taken the training or haven't had a chance to look at these, or if you're hiring new workers at your lead agency, we encourage those to take these trainings. We've got we had an e-list announcement about our trainings. We have timelines of when people transition from PCA and CSG over to CFFS. And then we have our lead agency training and the MMIS training, which can be found in TrainLink. These are the course codes for both of those. And then we also have a quick transition webinar about CSG to CFFS. Okay. And then I included a link to this week's e-list announcement, and I'm not going to go over it in detail with everybody because it likely won't apply to all of you, but we understand that some people are getting an error message when they're trying to enter or make changes to a service agreement. And the reason for that is because of the tiered wages and tiered rates that are that went into effect. So there is a workaround that is available for you if you are adjusting service agreements. So please go ahead and read that e-list announcement. You likely have it in your email. It just came out this Tuesday on the 15th. If not, you can go ahead and click on this link once it's posted on the archives page, or you can just look for the e-list on the DHS website to find information about what that workaround is. Okay, and then a quick reminder about the consultation services provider list. It sounds like there might have been some questions or comments wondering how you will know if the consultation service provider information has changed. And so I'm just going to click on this link for you to see. This is our consultation service providers page. And you'll see here that it has information about each organization. It does link to each of their individual websites if you want more information about each organization, but then their address, phone, email, the languages that they have someone on staff speaking. So they're all required to use interpreters if needed, but these are the languages where they have someone on staff who can speak that language. And then all of the providers are enrolled at this point. Okay. So at the very bottom of the page, it does say the date it was updated. So this page was updated just here in April 2nd. So if you're wondering if it's current, you could of course look there. Otherwise, if we're notified of a change, we do make that change, quickly, typically within a few days of being notified. So we encourage you to always refer to this page rather than maybe a copy that you've saved on your desktop or a page that you've printed out with their information, because their contacts do change from time to time. Okay, and then one thing that I wanted to say actually before we get on to the rest of the presentation, we just left an FMS meeting this morning. So we were meeting with the financial management service providers and got some feedback from them. And I don't have a slide on this since we just had that meeting right before this one started. But they had asked if what the expectations are regarding the 6893W. And that form, if you're not familiar with the number, that is the addendum to the service delivery plan. And the expectation is that the lead agency is going to submit or complete the 6893W, the addendum to the service delivery plan, for every service delivery plan that is approved. Okay, so regardless of if you need to make changes to the plan, or regardless of if the plan was developed early enough where there won't be that there won't be the change in dates or the change in units, you still need to complete the 6893W. So every plan should have a 6893W that accompanies that plan. Okay, and that's really the approval page. That's the page that you're responsible to sign. That gives the information to the person about the goods and services, the personal care, the PERS, et cetera, that have been approved. That's the page that either you or someone within your lead agency is going to refer to when entering the service agreement. So we just want to make that clear that that's required for every service delivery plan. Okay, now we'll get to the rest of the presentation. That is the questions that were pre-submitted to us. So this first section is going to be on the transition from PCA and CSG. So this isn't formed as a question, but we did receive a question about if the CFFS units can be split if PCA units can be split between service agreements for those 6-month service agreements where you're extending the PCA. So we understand that sometimes people are splitting units, maybe like 60% of them and 40% of the units in the second half of the PCA year. So we're going to review those on a case-by-case basis. So it really will depend. So if the service authorization line is under or over, you're not able to really approve that on your own. And so you'll have to send a request to our service agreement and screening document team, or SASD, and we put that email address on the screen here. So dhs.sasd or SASD support@state.mn.us. Okay, so go ahead if you run into that scenario, someone who was splitting it before CFFS, and if that can continue, just go ahead and send us an email.
Erin?
Yeah.
There's a question in the chat just clarifying that when we're saying the 6893W is required, that it is not required for MCO recipients. It's just fee for service.
Yeah, thank you. So eligibility and assessments. How is additional time given for a person who has been assessed for behaviors? Okay, so if someone has been assessed for level 1 behaviors, that means they're eligible for CFFS. And then a person may be eligible for an additional 6 units, but there are 2 units for each of the following. So if someone has physical aggression and property destruction 4 or more times per week, they would be assessed for 2 additional units. If someone's has vulnerability, socially inappropriate behavior, then they have, and that's 4 or more times a week again, they would receive 2 additional units. And then for verbal aggression and resistive to care, again, that's 4 or more times per week, they could receive an additional 2 units. So that's a total of 6, so 2 units for each of these. Next section is on MMIS. So can the lead agency force the 847 edit code when entering additional consultation services units? So no, the lead agency is unable to force that edit. Only our SASD team can do that. And so you'll need to submit the 6893I if you get that edit code. Okay, the next group of questions are on the change in condition, provider and service delivery plan. So is a revised service delivery plan required for a change in condition? Can the increase of units be backdated to the date of assessment rather than the date of the plan approval? Okay, so if a person starts with a 45-day temporary increase, no revision is needed to the 6893P. Okay. Then if the person needs to have that, or that change of condition is really longer than that 45 days, then the a full reassessment is needed for that change of condition. And that is when a revision to the 6893P is needed. Okay, if that's going to last longer than 45 days. And then, let's see, can the increase? Oh, backdated to the date of assessment. Janine, I'm realizing I didn't answer that question on the slide. Can you jump in and answer that piece? You backdated the date of assessment rather than the date of plan approval. So no, typically that is not allowed. I don't have that on the slide. Sorry about that. Do you have anything you want to add to that, Janine?
No, I think just the clarification that the header date has to cover the span that is based on the assessment. But the service lines will be different for when the plan is approved and when the providers can start.
Thank you.
Uh-huh.
All right, so consultation services. Is there an alternative to email for how the consultation service provider can notify the lead agency that the service delivery plan has been uploaded into MinChoices? So no, there is not. And we understand through some emails that we received and a meeting that we had with our MinChoices team that some information was shared incorrectly at a recent MinChoices office hours. And so we apologize for that on behalf of DHS. But so although there is a function in MinChoices for a consultation service provider to send you an email like within the MinChoices system, it's actually not something that we're able to use right now. And the reason for that is we just haven't done the right testing, and we don't know how long the information has been or can be retained within the MinChoices system. So right now we've been told that we cannot utilize that function within MinChoices, and the consultation service providers need to use the contact list that we've provided to them for each lead agency. And they should be sending you an email, just a regular email outside of MinChoices to notify you that a plan has been uploaded. Okay, and we reviewed this with the consultation service providers yesterday as well. We understand we do get feedback from you guys every once in a while that says you're not being notified. So we are reviewing that on both sides, both with consultation service providers and with you as lead agencies. Okay, the next section is on covered goods and services. So who's responsible to make a referral and assist the person with selecting a PERS provider? Okay, so the consultation services provider is responsible. There's kind of two different pieces. So consultation service provider is responsible to answer the person's questions about PERS, review the service delivery plan, and provide guidance to the person about whether it meets the eligibility criteria, and then send the service delivery plan to the lead agency if they want to include PERS, right? But the lead agency is responsible to approve that service delivery plan and authorize the PERS provider. So the consultation service provider, they may not know who is an enrolled MHCP provider of PERS. That's really something that the lead agency is going to need to help the person find an enrolled provider. Okay. Is the speech tablet a CFFS covered good? So no, it's not. And you can, well, I just put this link here if you want to review the page on our policy manual about covered goods and services. Speech tablets might be covered under medical assistance, but not covered under CFFS. Does CFFS cover the cost of a fence for children? And does CFFS cover fences in general if it's related to safety? So no, the offenses are not a covered good under CFFS. And just a reminder that goods and services purchased through CFFS must meet all of the following. So it must be related to an assessed need, must be for the direct benefit of the person. It must increase the person's independence and really replace the need for personal care from another person. And then those have to be included in the service delivery plan. Okay, but a fence is not a covered good under CFFS. Okay, the next section is on the CFFS service delivery plan. Will DHS consider developing a review checklist for lead agencies to use when reviewing and approving CFFS service delivery plans? So yes, I understand this was brought up at our last meeting, and that is something that we're going to start working on. It's not completed yet, but once that is done, we'll go ahead and publish that and let everybody know that that we do have that checklist available. So this is a scenario in question. So the lead agency approved a service delivery plan, but was notified by the provider that the information was entered incorrectly. Does the person have to stop services while waiting for the consultation service provider to update the service delivery plan? So in most scenarios, no, the person would not need to stop services. Once the plan is approved, the workers can continue to provide services to the person while the consultation services provider revises that plan. Okay, and we do know that plans will be revised throughout the year. So we don't want that to be like a hindrance or a stop for a person just because they want to revise their plan. So they can always continue with those services, as long as they're not going over budget or over that line item if they plan to move funds from, say, personal care to purchase a good or a service. But early on in the plan year, as this kind of question alludes to, likely that person wouldn't be running out of personal care dollars. And so those workers can continue to work while the plan is being revised. Can lead agencies revise the 6893P or the service delivery plan and then authorize services? So an example that was provided was a person list a non-coverable IADL task. Can the lead agency cross that specific task out and authorize that plan since the hours don't change? So in this specific scenario, yes, if the change that the person is making or the lead agency is making does not affect the units and dollars, then that could be crossed out in the plan. And the lead agency is going to document that change. On the service delivery plan, there's a comment box at the bottom where the lead agency is signing the form. It's titled Lead Agency Comments. And so you'll want to make sure that you're making that notation in that box so the person understands that, in this example, that IADL is not covered. Okay. Should the lead agency adjust the dates on the service agreement that is suspended because the chosen CFFS provider agency is not yet coded for CFFS? So there's kind of two different dates that could be on a service agreement. So the header date, or like the main service agreement header date, that would not be changed. But the lines, the service agreement lines for personal care, those dates would be changed. And so the dates for the personal care line, it needs to be adjusted once that provider is coded for CFFS and the provider indicates that the person is able to begin services. That would be the date that should be entered on the service agreement line. Okay, Janine, I think I'm going to have you talk through this slide, but the question is, plans are being submitted with IADLs that include things like heavy household chores, light household chores, homemaking, and laundry. What tasks can be covered under IADLs? Can you talk through this one, Janine?
Yep, sure.
Thank you.
So we are aware that MnChoice's language and what MnChoice's calls heavy housekeeping and other things don't necessarily line up with our list. So on the screen is the list of IADLs from statute. And our trainer is working on putting together some clarification and kind of matching things up so that you have the right words for our CFSS side as well as min choices. So we'll be giving you more of those things, but there are IADLs that are assessed by min choices that are not coverable under CFSS and some that are coverable. So we will be providing some of that language to help you. I know there have been a couple of questions about IADLs that aren't covered under CFSS, which is true. There are IADLs that are assessed in min choices that don't match what can be covered, but we only expect like IADLs that can be covered in CFSS to be included in service delivery plans.
Thank you.
Yep.
So CFSS agencies are asking lead agencies to make changes on an approved service delivery plan. How does the service delivery plan affect the CFSS providers or agency providers? And in the event of an audit, does that service delivery plan come into play for the agency providers? So yes, it really does. So agency providers, they have to have a plan that reflects the needs of the person, okay? And the agency providers are then, they are required to follow what's written in that service delivery plan. So they need to make sure that all the information is accurate so they can follow it correctly. And then they are really providing the services that are in the approved service delivery plan, right? And so auditors, they can go in and review the service delivery plan, and then the worker time and activity documentation. So the timesheets, for lack of a better word, that the provider agency is keeping, that showing the tasks that the worker is doing, and they need to make sure that those match what's in the service delivery plan. So if the worker is documenting something that's not in the service delivery plan, that's an item that cannot be billed. And then that would come up in an audit. And so if the provider agency is asking you to make changes on a service delivery plan, that is something that you're going to want to work with consultation and the person to make sure that that's being done, because that is really important to those agency providers to make sure that they have all those needs listed correctly. Okay. So is there a timeline that must be followed when a person has an approved service delivery plan and is ready to transition from PCA to CFSS? So as you all know, we had the first 6 months of legacy PCA or CSG for a person. And then we just recently announced that a person can get an additional 6 months of PCA or CSG services. So really the person has up to 12 months of PCA or CSG. So that's really the first timeline. But the person doesn't have to utilize those the full 12-month period of time. If they're ready to go before that 12 months, that's actually ideal, right? They should be switching over to CFSS. But you as a lead agency will need to make sure that the provider is ready to transition the person to CFSS, because there's some things that even if a provider is coded for CFSS, they still need to work with the person to make sure that their workers have completed, if there's any training or orientation that needs to be done. And then they need to make sure that they've done essentially like an intake with the person receiving services. Okay, so they need to make sure that the provider is also ready for the person to transition to CFSS. But they do not have to utilize those full 12 months if they're ready to go. Okay, do all IADLs need to be listed in the service delivery plan? So this question comes up in almost every lead agency office hours that we do for both consultation, for provider agencies, lead agencies. So we just want to reiterate to everybody is no, not every IADL needs to be listed in the service delivery plan. Only the IADLs that are associated with CFSS need to be in the plan. Okay, so the person may have IADLs that are not associated with CFSS, and the consultation service provider does not need to put those in the service delivery plan. Okay, so you will, as a lead agency or case managers, will be completing the MnChoice's support plan. And you need to make sure that that plan addresses all the assessed needs, but the service delivery plan is specifically for CFFS. Okay, the next group of questions are regarding spouses and parents of minors providing services. So does there need to be a schedule for a parent of minors providing services to 2 minors in the home? So I'm assuming like a sibling group. In addition, if the eligible units exceed the 60-hour limit, that is for one parent providing services to both minors, do lead agencies still need to authorize that amount, or do they only authorize up to 60 hours for both children? And then in addition, how in-depth do goals have to be on the 6893P? So no, a schedule is not required. It's not required for any worker. So parents or non-parents, the schedule is not required. And lead agencies, you want to make sure that you're always authorizing all available units or dollars to the person. So there's nothing that should be left like unallocated or unavailable to the person. Anything that they are assessed for, their total units and dollars need to be in the service delivery plan and on the service agreement. So even in this scenario, if you're thinking, well, there's just one parent working with the 2 kids and they can't work more than 60 hours, throughout the plan year, the person may choose to hire additional staff or additional workers. And so you want to make sure that those units and dollars are available for the person. Okay, and then it's really up to the FMS provider or the CFFS provider agency to manage those worker hours and ensure that the worker is not going over that 60-hour limit. And then regarding the goals that are in the 6893P, these can just really be basic goals that the person wants to achieve. They don't really need to be as in depth as they are in MnChoice's. So they don't need to, you don't need to have they don't need to be measurable goals that anybody is tracking, the provider agency or the FMS provider. They can just be, kind of simple basic goals that the person wants in their plan. All right, the next group of questions is regarding the budget model. So lead agencies have received some service delivery plans with the FMS payroll taxes and employer benefits calculated incorrectly. Then the plan was approved and the FMS provider corrected those taxes and benefits, which caused the person to have to adjust the hours so they're not over budget. So the question is, should that plan have been revised? So there's a couple different scenarios that could occur. So if it's the incorrect FMS fee, so their monthly fee, I think on the service delivery plan, it's entered as a yearly dollar amount. But if their FMS fee is incorrect, then yes, the consultation service provider has to revise the plan. The reason for that is a revised service agreement is also needed. Okay, so that needs to be resubmitted to you so the SA can be changed. If it's just an incorrect worker budget section, so that's the piece where the payroll taxes and employer benefits, so the PTO and workers' compensation, et cetera, is added into the plan, the 6893P does not need to be revised. And the reason for that is that total is all entered into the T1019 line. And so if the payroll taxes or benefits are slightly higher or slightly lower, that doesn't change the total amount that's available on the T1019 line for the person. So the FMS provider, they should be adjusting those percentages to make sure that they're correct. And then of course, they are billing the correct dollar amount, and that's all billed out of that T1019 line. Okay, so the FMS provider should be working with the person and notifying the person of the actual available number of hours that are available for that person. Okay. All right. So, worker training and development. If a parent of a minor child is going to be the CFFS worker, can the worker training and development budget pay for parent coaching? And we had this slide last time, and the answer is still no. So we got a follow-up question sent to us, so we just wanted to talk through it a little bit more. That the training that can be covered under worker training and development is a training that any worker could take, and it's not just specific to parents. So that's really why the parent coaching wouldn't be approved. The training needs to be specific to the individual, not specific to the individual receiving services, not necessarily specific to the worker. And in this situation, that this training is just specific to parents. Janine, is there anything you'd like to add to that?
I think you got it. It just really needs to be about the worker and any worker that would provide service. Yeah. You
Okay.
said it.
So some other questions that were submitted. Lead agencies have received service delivery plans that do not account for the different days in the month. Does the plan need to be revised, or can lead agencies make the change on the 6893W? So the service delivery plan and the addendum, the P and the W, they're really calculated based on the total number of days in the service delivery plan. Not the days, or I'm sorry, the days within the service plan year, rather than the days of each particular month. And all of those units and dollars can be used flexibly throughout the service plan year. And so as long as the 6893W is calculating or listing those dollars correctly as, or the correct units or dollars for that service plan year, and that's entered correctly on the service agreement, then there's nothing that you should need to do regarding the service delivery plan for days of each particular month.
Right. I think, Erin, it's a little bit like in PCA land when we talk to people about how they wanted to use their flexible services, and they said more time in the summer, less time in the winter, those kinds of things. Not necessarily, we're not really expecting necessarily exact like numbers of units per month. It's just a little, it's giving people an idea, the provider an idea of how they're planning to use their year's worth of units.
Thank you.
Mm-hmm.
Does a lead agency need a release of information for consultation service providers, FMS providers, and provider agencies? So yes, you do, and you'll just need to follow whatever your lead agency policies are. Last pre-submitted question was, can a targeted case manager act as a person's responsible party? And no, they cannot be the person's responsible party. Okay, so that is a review of all the questions that were submitted to us in advance. I'm assuming some questions are in the chat. I have not, or the Q&A, I have not looked at them myself. So I'm going to pause for a minute to look through the questions and maybe turn it over to my colleagues who have been looking at the Q&A a little more, if there's ones that you want to review right away to start.
So I think we are going to have to come back to the communication devices because we have a couple different thoughts about those things. So anybody who asked about communication devices being covered by CFFS, we're going to have to loop back on that. There was a question about a W addendum on a denied service delivery plan. So Fair point. If a service delivery plan is approved, every single one of those need an addendum. If it's denied, all of, the notice of action and all those things have to happen, and you're not required to do an addendum until you're actually approving a plan. I think there's a question. There's a question about someone changing lead agencies, so maybe moving to a different lead agency, and I assume that's a waiver situation since our type B agreements remain the same no matter where you live. So that may be a CFR transfer. And I think the RS is on the line. That's delineated probably in waiver CBSM parts.
We don't have an answer for that question at this time. We'll have to take it back.
Okay, thank you.
And Janine, I seem to have lost my view of everything, so I think I'm going to need to have you read the questions. I apologize.
Sure, that's okay. That's okay. I don't know if we said this to this group, but we have a matrix document that we are going to publish. It'll give more direction around some of the changes that need to be made and who's involved and who's required to send the information to DHS or make the change, etc. So that might help some of the questions that people have. So there is a question about how up to date the FMS fees on the DHS website. We're regularly seeing plans from consultation providers with incorrect fees when they are easily looked up.
Yeah, I can talk through that. So the
Sure.
FMS fees should be correct. I mean, when they make a change to their fee, they're supposed to notify us. And so, but just yesterday we met with consultation service providers, and one of the pieces that we reviewed with them was the importance of looking up the FMS rates with every service delivery plan that they're creating, because those do, as you know, those rates do change from time to time. And so we reiterated that yesterday and showed them where to find the rate sheets, and that they need to be reviewing those rate sheets each time they create a service delivery plan. So hopefully that will start to resolve itself going forward. It might just take some time for them to change their practice and making sure they're looking up each and every time.
So there's a question about the purpose of including IADLs on the CFFS service delivery plan if the person intends to get support from a waiver service and not their CFFS staffing. This is causing a lot of confusion. So I think the piece about CFFS that was also true in PCA is that anything that a person a worker does needs to be included in the service delivery plan. So if waiver is doing some of those things that could be coverable under CFFS, if it's not put on the CFFS service delivery plan, the CFFS worker can never do it or bill for time. So that is why you might see something on a CFFS service delivery plan where it's a covered service, but it's not going to be done by CFFS staff. But we ask that service still gets on the service delivery plan, so that in case something changes in the future, the personal care worker could pick it up if need be, and they would be able to bill for that time. So we talked a little bit about PCA extensions, and that is really applying to type B service agreements. Yeah, it's really about type Bs. Waiver service agreements, of course, can be managed by the case manager. Sorry, we're having a little bit of technical difficulty, and I'm looking through some of the questions as well. So there is a question in chat about reconsider having a change of condition units start the date of the assessment. So if you're doing a change of condition full reassessment, that creates a new span based on that assessment. And so you would have to match up the CFFS and the waiver spans as the case manager or care coordinator. A 45-day auth, a 45-day temporary auth to allow you to get more information and to do a face-to-face assessment and all of those kinds of things. Doesn't change the year span of the assessment being eligible, but if you do a reassessment, that does change the span.
There's a question in here about people moving from one lead agency to another when they're using state plan services, and a couple of questions. And so just looking at that, I just would like to point out that it's not any different from PCA. That being said, I do realize it's different. Talking out of both sides of my mouth here. I do realize that it's different because now we have a service delivery plan. But what I would suggest is if you're the lead agency that completed the assessment and you're working on the service delivery plan and that individual moves, you'll need to communicate just as you would if the individual was on a waiver and receiving services. So there might be some coordination there. I think really it comes down to the details of when they move and where you are in the process as well. So I don't have a black and white answer for you, but this would certainly be something that if you had questions about when this was happening, you could reach out to us and we could provide some clarification. There are just kind of a lot of factors that could be involved in that, but CFFS is not a time excluded service. So just to keep that in mind.
Thanks, Meredith. There's a question about the 6893 I's, and is there a plan to have an auto reply email sent for forms submitted? It's actually the I's go to SASD, and when we talked to them about that this week, they said there is not a plan to have an auto reply email sent at this point in time for the I's or the K's.
Yeah, and I think what they said too is that you should, after it's submitted, you should have a new screen come up on your computer that says something like, thank you for your submission, or there is some sort of acknowledgement screen. So if you're not getting that, that would be an indication that your form didn't go through. but there should be, your screen should change to indicate that it's been submitted.
Yep. There's a question about a difference. Is there a difference between enhanced and complex CFFS? And actually that's pretty much interchangeable. We are using that basically to mean the same thing. So it's somebody who has 10 hours or more eligibility of state plan benefit PCA or CFFS. And that actually is paid out at a higher rate. We authorize it at the higher rate, and it's paid out at the higher rate if the worker meets the requirements, but it's the same. We use enhanced and complex together as the same.
Thanks, Janine. I was just going to say that. I can't recall off the top of my head. The difference in words might just be a little bit. I'm wondering if complex is part of the definition in min choices or part of the, is in the actual revision application. But yes, it's the 10.5 hours to get that enhanced rate.
Yeah.
Fine.
So yeah, I think it's we use it like on the assessment side and probably screening documents, service agreements, stuff like that. But I think the enhanced rate is kind of how we use it on like the rate side. So, but it is the same thing.
Yep.
So there's a question about issues with the providers not sending in referrals for reassessment of CFFS. So I think this is complicated this year because when we're talking about putting in 2 separate type B agreements for 6 months each, it's been hard for the providers to always keep track of when the person is actually due for their reassessment. So I know we've gotten some complaints from lead agencies that provider agencies have sent it in because one of the 6-month extensions is ending, but the assessment actually wasn't due until the end of the second 6-month one. We have talked with providers about their responsibility to do that, but we've also asked them to be careful so that they don't overload lead agencies with assessment requests for people who aren't actually due for that annual assessment. But of course, providers don't have the benefit of looking in MMIS or in Min Choices to see when the actual year is. But we can bring that up with them, just knowing that you might end up with more assessments than what are actually due that you'll have to weed out on your side. So there's a couple questions about 10 hours. And so really the enhanced rate or the complex PCA that we use to delineate the person who has more than 10 hours doesn't have anything to do with really the complex health pieces that are in the assessment or that count for time. It's very separate. And so it's really what we're really talking about is those people who have the entitlement of 10 or more hours a day of state plan services.
Are there any more questions to review? Just have just a couple minutes left.
I think there's just to follow up on the reassessments again. So the providers do get letters that say 60 days from now your service agreement is ending, to remind them, and the person gets an email or a letter at some point in that 60 days. It might be at day 30, I'm not sure, but so they do get letters. The only letters that we have not going out related to the 60 days is the letter that comes to DHS because our no pay code is on the line. But otherwise, everybody else who has a line on that service agreement is getting a notice that in 60 days the service agreement will end. So we can bring it back to them and, you know, remind them that that's their responsibility.
Great. Thank you, Janine.
Yep.
I appreciate you going through all those. So just like I said at the beginning, just want to remind everybody that we're going to switch our frequency starting in the month of May to be once a month. We don't have that exact date solidified yet for May, but once we have that information, we'll make sure that that is emailed out to the lead agency supervisors along with a link to register. It's the same link we've provided in previous weeks, but we'll get that posted as soon as we have that information, and we'll look forward to seeing you again in May. Thank you.